The next question is, how do you assess initial dosing?
So I have an algorithm I developed. Basically, the first 1,000 patients or so, let me back up. Sorry. So I got to start the story earlier. So what do you do? What does a doctor normally do? How does a doctor pick a dose in the office? Like normally you're in the office, like I'm in the office, you come in, you tell me your symptoms, tell me what's going on. I write a prescription. How do I choose that dose? And it's kind of a gestalt. We sort of listen to the story, we get an idea, we have a dose we think will work. And that's the way most of us prescribe. That's basically all of us prescribe hormone replacement therapy or most medicines. There are certain things that are more sort of textbook, but in general, there isn't a lot of heavy science behind this, behind dosages. And in fact, even things like antibiotics or really anything, the pharmaceutical companies will do studies on a few different doses, see which one works best, and then that's the dose. There's a medication called Cytotec that we use to induce labor. And I remember when that first came out, I was in residency and nobody knew how to dose it. And so we all tried different stuff until eventually studies came out and we had a lot of experience and we realized sort of what the best dosing is. And there's still some controversy over that. So to start the story off, it's like, well, what do you do in the office? You kind of listen to the story, you go with your gut, you write a prescription that usually works for people that have that cluster of symptoms. And so that's sort of the way I started. And then I thought to myself, I want to try and I really wanted to build an algorithm. So honestly, when we first started doing this, I was the only doctor. And the information, I would get the information, and then I would come up with a dose, just like I did in the office. And then I decided, I want to be more scientific about this. And I want to be able to build a system that when we expand and we start hiring other doctors, will be easy for them and we'll give them a dose that sort of is recommended. So I started paying real attention for the first 1,000 patients. I'd come up with a dose and then I'd stop myself and I'd think, what is it about this patient and this cluster of symptoms and this BMI and this history that made me think of this dose? And I started doing that. And then about halfway through, about 500 patients in, I kind of came up with an algorithm. And then I sort of followed that for the next 500 patients. I made some adjustments. And then I kind of came up with this algorithm that spits out a dose now. And so I took away that gut thing, figured out what it was that was really triggering that, and sort of did it a little more scientifically. And then I've been following that now. So now, what do we have? 4,000 or 5,000 patients, I think, have come through Winona, somewhere in that. And I've been watching it carefully and making sure that for the vast majority of patients, that first dose is the right dose. Honestly, I'd rather underdose you so that if I'm going to err, I'd rather err on the side of not enough medicine. My philosophy is that you should be on the lowest amount of medicine, the least amount of medicine needed to take care of your problem. So yeah, I can make you feel better with a ton of medicine, but then there's going to be more side effects and more risk. And so if I'm going to make an error, I'd much rather err on the side of not enough medicine and then increase the medicine, sort of titrate it until we get your symptoms under control. I mean, honestly, I'd rather nail it the first time and get it right. But if I'm going to err, I'd rather err on the side of caution. And so that's kind of what I've been watching it for. And I think, I've got it dialed in pretty nicely now. The majority of patients, that first dose is the right dose. Some of the patients, we need to increase the dose a little bit. When we get down to that 2.5, 3 month place where it's like, gee, it should be working by now. It doesn't seem to be working. We need to increase the dose a little bit. Every once in a while, I go too high. People have side effects. We need to back down. But fortunately, that's pretty unusual. And so I feel like I've got it dialed in pretty well, but it's something I keep a close eye on.